Greetings, and welcome to the Spotlight on the Ins and Outs of Telemedicine in Parkinson's Disease Web Teleconference Education Program. At this time, all participants are in a listen-only mode. If you are participating by telephone and require assistance during the teleconference, please press *0 on your telephone keypad. If you are participating by web, please disable all pop-up blockers to ensure that you are able to see all aspects of the program. It is now my pleasure to introduce your moderator, Dr. Rebecca Gilbert. Thank you, Dr. Gilbert. You may begin.
Thank you so much. Welcome, everyone. Thank you so much for joining us today. My name is Rebecca Gilbert, and I am APDA's Chief Scientific Officer. I am pleased to welcome you to this web teleconference education program designed for people with Parkinson's, their care partners, family members, and healthcare providers. And I would like to thank at this point Neurocrine Biosciences for funding this important program. And I want to acknowledge Neurocrine's appreciation for the critical need to provide educational programs like this one to people impacted by Parkinson's disease as well as their loved ones. Now, we know that you have continued concerns regarding your Parkinson's treatment, and you want ways to identify how to live your best life with Parkinson's disease. American Parkinson Disease Association, or APDA for short, is the largest grassroots network dedicated to fighting Parkinson's disease, and we work tirelessly to assist the approximately 1 million Americans with Parkinson's disease. APDA distinguishes itself as the national organization working one-on-one with the Parkinson's community to make each day better. And now to our program. We welcome our distinguished presenters today. We have Dr. Chantal Branson, who is Assistant Professor, Movement Disorder Specialist, and Sleep Medicine Specialist at Morehouse Healthcare, located in Atlanta, Georgia. And she's also Assistant Adjunct Professor of Neurology at Boston University Medical Center in Boston, Massachusetts. She is joined by Dr. Drew Falconer, Director of the Inova Parkinson's and Movement Disorder Center and Associate Professor of Neurology at UVA School of Medicine Inova campus in Falls Church, Virginia. And they are here to discuss with you and share their expertise on telemedicine in Parkinson's disease. After the presentation, we'll open the program for questions from both telephone and web participants. And we encourage everyone on the line to complete the evaluation after the program because your feedback is instrumental in helping us plan for future educational offerings, including web teleconferences like this and other programs. You may view the materials for this program and today's slides by clicking on the Handout tab in the lower left-hand window on your screen. And it is now my pleasure to turn the presentation over to Dr. Falconer.
Thank you, and thank you to everybody who's joining us on this beautiful afternoon. I hope the weather, wherever everyone might be, is as beautiful as it is here in beautiful sunny Northern Virginia. My name is Drew Falconer. I'm the director of the Inova Parkinson's Movement Disorder Center here. And it's a real pleasure to be joined by Dr. Branson and everyone else to have a really important conversation today around the subject of telehealth. These are our disclosures on the screen. It is an important part of all that we do to disclose where we consult as well. And with that now done, I do want to jump into our topic for today. Now, telehealth is something in our world that we actually have really loved. Many of us physicians have really enjoyed the ability for our patients to reach us through telehealth. That being said, you will see a lot of discerning voices out there questioning the need or the use of telehealth, especially in a discipline like Parkinson's disease and movement disorders. And so we want to spend today talking about why, at least in our opinion, this makes sense, telehealth that is. And I think the biggest reason why telehealth has a real role in our worlds is not as a replacement to an in-person visit, but simply as a tool that we can use to improve one of the greatest barriers to getting better with Parkinson's, and that is access to specialty care like that which we deliver. And I mean it, it's on the screen, and I'll try to back it up. But telehealth and Parkinson's disease has always been a fine pair. It's something that has always made sense to us who strive every day to make people's lives living better every day with Parkinson's. The reason why telehealth makes sense is that there aren't a whole lot of us. There are not a lot of movement disorder specialists, that being neurologists by training, who do extra training to become specialists in Parkinson's disease. And for those out there living with Parkinson's or with somebody in their lives who they're caring for or on the journey with them during their walk with Parkinson's, you know that Parkinson's is complicated. Parkinson's is a condition that affects every system of the body, and it affects different systems at different times. And the hardest part is it changes over time. The challenge is, what we face every day, is that we have 1 million people in the United States with Parkinson's disease today. 1 million people. That is going up by the month, by the day, and by the year. But the vast majority of those patients, by recent data, more than 90% of those patients have only tried one medication for Parkinson's disease. And the vast majority of those patients have limitations in their daily living that holds them back. Well, guess what, folks? If you haven't heard it yet, let me be the first to let you know that as of today, we have 23 medications indicated for the treatment of Parkinson's, 13 of which are new in the last 5 years. We have 4 life-changing pieces of technology. We have tools available today that 10 years ago seemed like a pipe dream. But we have all of this advancement, all of this development, all of this better that we can offer to our patients. But yet very few patients with Parkinson's will have tried anything that we would consider new. And a big reason why that happens is the data you see on your screen. Only 28% of patients with Parkinson's disease will see a specialist like me. And the reason why that is multifold. And if you live with Parkinson's, you can most likely relate to this. Getting to a specialist takes time. It takes logistics. It takes travel usually. And the cost to that can be big. And so one of the greatest barriers we see for patients to seek specialty care is distance, travel, and time. In fact, there's a big study that came out in 2020 that looked at Medicare patients, all of Medicare, not just Parkinson's. And they said, okay, how are we doing for access? And in that study, it found that 20% of all patients with Medicare traveled outside of their hospital region for care. 20%, that's a lot of people. And the average distance people traveled was 148 miles to seek care. Now, out of all of Medicare, guess what the #1 condition was that traveled for care? It was Parkinson's disease. So within the Medicare community, those over 65, the most common neurological condition where people traveled at least 150 miles to seek care was Parkinson's, right? And so for us, that has always set up a use case for telehealth. If you can come and see me through your computer, through your iPad, through your computer, through your cell phone, then we don't have to worry about travel. We don't have to worry about the logistics of getting someone to bring you or to have your kids take off work and come pick you up. We don't have to worry about distance, time, cost. We simply log in and we can meet with the great technology that we have to advance your care to hopefully a better place. And guess what? Telehealth has always made sense for Parkinson's too, because as those know who have tried to get in with movement specialists, there's a lot of wait time for us. This is another study on the screen you can see that says that in the United States as of today, the average wait time for a new patient visit for Parkinson's in the US at a movement center like ours is 2.2 months. But that range is huge depending on where you live and the resources in terms of specialty care that are available. There are some regions in the US, especially the Midwest, where the distance to a movement center is hundreds of miles, and the next visit that's available is anywhere from 6 to 8 months out. That's not access. That is not easy access. That is not a path to better. And so that's why telehealth makes sense to us as a tool, not in place of an in-person visit, but to make access easier for those that a traditional visit might leave behind. And guess what? Prior to COVID, we've actually been able to do telehealth for a long time. In 2018, there was a study in Parkinson's patients in terms of telehealth, and this was actually in the US prior to the pandemic, that showed that in the Parkinson's population, 2018, only 38% of patients with Parkinson's could actually complete a telehealth visit. And the reasons why they couldn't were numerous. And there are things that seem to make a lot of sense in retrospect. So to do a telehealth visit, you have to be very comfortable with technology. You have to be able to interact with technology and follow detailed instructions to log in easily. Some people said no to telehealth because of privacy or security concerns. The platforms we were using were kind of junky. And then for a lot of folks, the availability of good internet connections was really limited prior to the pandemic. Now, there was a glimmer of hope that came from this data. And that hope was, and this was a study that came out before the pandemic started in early 2020, so pre-everything. It showed that the patients who in the US did end up doing telehealth visits, that 80% of those patients said it was the bee's knees. They said it was fantastic. They said it was great because they didn't have to worry about distance, about travel, time, logistics, all of these things that have classically been barriers to accessing specialty care like ours. And then the pandemic happened, and we all got better at doing what we do every day. If nothing else, the pandemic allowed us, by us, I mean us as healthcare and you as patients and their care partners in their world, it allowed us to become a lot better at telehealth. The technology advanced very quickly. The platforms became a lot easier, and we all became much more comfortable with technology, using technology. And the awareness of the access of telehealth just exploded overnight. And in many ways, that is a good byproduct of what's happened over the last few years, is that we have been able to take a tool, telehealth, that allows us to reach patients that otherwise a traditional visit would leave behind. And it's allowed us to meet them where they are. And in fact, our center here at Inova Health, we looked at the first 9 months of the pandemic, so that last 9 months of 2020. And at that time, we had 3 movement specialists. So at that time, we were at 3 of us movement disorder docs. Now we have 5 of us. But at that time, we saw in 9 months, 1,097 new patients. And of those patients, 85% were via telehealth. So the vast majority of our new patients during the first 9 months of the pandemic were through telehealth. And we have all kinds of data from that study that talked about the benefits that telehealth experience gave to our patients. But the biggest one is that almost 100% of those patients who we saw via telehealth had never seen a movement doc before. So that's evidence that telehealth is a tool, and it's something that we all need to realize is available for the most part, and we need to use it for the tool that it is, which is to make access easier. Now, there's some pros, there's some cons to it, so I want to run through those very quickly, and then I'll pass the baton to my good colleague, and we can talk more about how to get prepared for those visits and how to maximize that opportunity. But as you could guess, the benefits for telehealth are what people who do it every day can tell you. It is rather easy. It's like riding a bike. Once you figure out the process that goes into being part of a telehealth visit, it tends to flow easily into the future. And all of a sudden, you don't have to worry about distance, about travel, about time. We meet anywhere. We've done telehealth visits on the golf course. I've done telehealth visits in a parking lot. I've done lots of telehealth visits where patients are at work and they simply close their door and we do their visit. Or very easily, I can't tell you how many people I've enjoyed watching eat breakfast as we talk about their Parkinson's disease, sitting at their dining room table because it's that convenient. And there's a lot of data coming out, so feel comfortable that the telehealth experience is relatively on par with an in-person visit. Those of us doctors that do a lot of telehealth have really gotten good at using tools that we have available in physical exam maneuvers that don't require us to touch you to see how you're doing. I can't tell you how much better I am at looking at how people walk now than I was before the pandemic, because you can tell a whole lot about how someone's doing with Parkinson's and how their medicine is, how their mobility is, just by watching them walk up and down the hall. And we have data that supports that the outcome measures of telehealth-based services, even in Parkinson's, are relatively on par with that of an in-person visit. And the final is that a real benefit is it's just so much easier. So if you call us up or message me and say, I really need to see you, something's going wrong, finding a time for you to come in person to do a sooner visit is kind of a game of moving the ball in the shell, right? I have to find a time I can fit you in that works well with your transport and your logistics, and it tends to be a real challenge. A telehealth visit, though, is easy to add onto the schedule. Usually I tell folks, okay, we'll do a telehealth visit at 8:45 in the morning before clinic starts. We can go through what you need and slip you in a lot easier. Follow-up visits, fit-in visits, even DBS planning, deep brain stimulation planning, is a whole lot easier now for us because of the option of telehealth. But then there's some challenges, and we still are trying to figure out how to overcome these. And we can talk about this in the Q&A, and I know Dr. Branson's going to hit on these as well. But there's a lot of red tape and rules that get into the way of telehealth. We're flipping back and forth. Go back there. Red tape and rules. Okay. You still need technology, and you still need the internet to work. Every now and then we run into a situation where it's just not going to work. The internet signal is flipping in and out. Maybe they're on their cell phone and the cell connection isn't that good. Or someone's on they get all set up for telehealth and then they have a Motorola Razr from 2002, an old flip phone, and it just won't work. So the technology and the internet needs to be in place to really allow it to work. And then another challenge we have, and we run across this all the time, there are still physicians and institutions who are really uncomfortable with the idea of telehealth visits. They think we have to lay hands to truly be able to tell what's going on and fix things. And I always push back a little and say, sure, in-person visits are where it's at. That's what we need to do. But if we can see each other in person once or twice a year and fill in between with telehealth visits, then we're getting that touch point while also utilizing the tools we have just to make it so much easier. And then a big one is licensure. If you haven't heard this one yet, during the pandemic, for the first 10 or 15 months of the pandemic, even I think it was a little later than that, Medicare and CMS passed a rule where physicians could practice outside of their state of licensure through telehealth, and it was okay. And then all of a sudden, about a year and a half to 2 years in, all of the state licensure rules, the boundaries started to get put back into place. And you would end up in a situation like mine here in Northern Virginia, where I'm licensed to practice medicine in the state of Virginia. But if you are 10 minutes that way in Washington, D.C., technically we can't do a telehealth visit because I'm not licensed to practice medicine in D.C. If you're 15 minutes that way in Maryland, we can't do a telehealth visit because I'm not licensed in Maryland. But if you're 4.5 hours that way on the other side of Virginia, we could do a telehealth visit. It's arbitrary, it's stupid, everybody knows it, and it's ridiculous. But it's a licensure thing. And so it requires these licensing bodies to come up with agreements to allow for cross-state telehealth. And there's a lot of advocacy going on behind the scenes to try to fix this significant limitation to this wonderful tool. Then the final challenge that you'll hear is that there really isn't a physical exam. We can't lay hands on you through telehealth. We can't do Botox injections through telehealth. We can't adjust a DBS through telehealth except with the Abbott system, which can. So there are certain things in our world that we still need you in person to do. But it takes thinking about this a little differently. It takes realizing that the tool of telehealth is there not to supplant an in-person visit, but to be an option in place of, if the logistical reasons make sense. And so I challenge everybody to think about how telehealth might fit into your world and how it might make your daily life easier, and then to find those people and those partners that can help you make it happen. And with that, I am pleased to pass over the baton to my colleague. Dr. Branson is going to finish thoughts with me and then take you through the second half of our day.
Thank you. Thank you, Dr. Falconer. That was fantastic. Everything that he stated is so true, especially when talking about the beginning of telehealth. So our institution, luckily, we were able to transition to telehealth prior to COVID. And what we've heard over time is that mainly people who have challenges with using the platform or using the internet or using the hardware of some sort, that's the main challenge or burden. So the most important part is to talk about the pre-visit. Once you become comfortable with the platform that your particular physician or clinic uses, it can be a bit easier and less cumbersome if you find it to be cumbersome. As stated, with COVID, it kind of pushed us forward a little bit. And that was the one positive thing that we can possibly talk about as well. So the pre-visit, basically we want to make sure that you have an understanding of what is expected of you during the visit. You want to kind of review whatever information the clinic or the physician or the staff support team has provided to you. Some places will email you something. Others may provide you with a printout and sending that over to you. Reviewing that, making sure that your software is compatible with what they need to have a successful visit. You want to make sure you understand if you can use it on your phone or if you need to have a laptop. Going back again to talk about the internet connection. Sometimes that can be a challenge, but these days, a lot of the systems that we use are compatible with both either a laptop or a cell phone. So that can be good. We can switch easily to a cell phone if needed. But just finding out that information and sometimes even using it, going through their preliminary steps prior to the visit is important and essential. It makes you feel more comfortable with using the equipment if you have not done a telehealth appointment before, or if their hardware or their platform has changed since your last visit. It is important to try to use that and maneuver it to make sure that you feel as comfortable as possible. So the instructions should include the type of device that you need to use, and sometimes it may include the internet browser that you should use. Sometimes one browser works better than another one. They may have a preferred browser. So just looking at that and making sure you understand it prior to the visit. Even calling the clinic or the support staff team prior to the visit is really beneficial, because you want to make sure that you have a grasp and understanding of what is going on. And if you don't, maybe they can walk you through it. Other times we've had loved ones, family members, friends, neighbors to kind of assist with that as well. So if for some reason there's issues with connecting with the provider or the clinic prior to the visit, reaching out to someone you feel comfortable with who wouldn't mind walking you through that is also beneficial. Hopefully you will have received your instructions, including a link that you will use on the day of the visit. And you should just go ahead and, unless the instructions, say something else, go ahead and try to use that. Try to see what it's like to log in. Try to just make sure that you have everything set up the way that you like it prior to the visit. On the day of the visit, you want to be able to log on early. You want to get into the system. Once again, you should be comfortable or at least more familiar with it, even if you're not comfortable with it. You want to be familiar with it and have a basic understanding of how to use the software. And then you want to possibly be patient. Be patient with the technology, because there can sometimes be glitches. Once again, the unknowns, the unpredictable parts of it is usually the internet service or the connection. Sometimes those can be a challenge. If you have the capability to have another device available if needed, that's always good. And or the provider or the team of people that you will be seeing may be running slightly behind. So logging on early, being prepared, understanding that, we're going to kind of go with the flow a little bit with it. You also want to try to make sure to the best of your ability to not perform any other activities outside of the visit. Some of the things that I've seen in my clinic, and I'm not sure if Dr. Faulkner can attest to some of this, but, sometimes people are driving, which can be not only a distraction, but a hazard. It could lead to an accident. So typically, if I see that, I try to ask them to not drive. What we do in our clinic is we have the medical assistant reach out to them first and tell them the instructions, make sure they understand them and that they've used it, and then ask them to log in within 5 to 10 minutes prior to the visit to make sure there are no issues. And during that time that they're having that conversation about the logging in process, they say, we really want to take this time to focus on your concerns and your needs during the visit. So if you can not do anything that's just not distracting, such as driving, using the bathroom, sleeping in the bed, or eating breakfast, it's fine to eat breakfast. Dr. Faulkner mentioned that. That's okay as well. But, as long as you're not like out in a busy restaurant at breakfast time, and it can be hard to really focus on that. You want to limit your distractions as much as possible. Also check your lighting to make sure that myself as the provider or anyone else can kind of see you clearly. During the visit, it is your time. It is your time to discuss your concerns, your questions, your medical problems, anything that is going on with the provider, and to have a really, it's pretty intimate conversation because you are most commonly, my patients are at home. So I get to see some of their surroundings. I get to see if they have someone with them who's helping them, a family member or something of that nature. So really being able to have that conversation. And that's why you don't want to be distracted with other things that are going on. And while there are certain parts of the physical exam that we're not able to do, there are parts of the exam that we can do. And that's why lighting can become important. There are parts of a memory test that we can do. We can evaluate memory parts of it through telehealth. And that has been very instrumental with the prevalence of the telehealth system. There's certain types of what we call cranial nerves. So these are examinations of your cranial nerves of the face and potentially the hands. These are different parts. So sometimes people can ask you to test for your sensation, and that's your senses of your face or your hand, using your hands, or test your own strength, how fast, your fast finger movements. We can also evaluate you or watch you walking. So there are different parts of the examination that we can and do test during the visit. So what has telemedicine, and Dr. Faulkner has already addressed this at the beginning, so I don't want to be redundant in this, but particularly the impact of the community, particularly with certain underrepresented, underserved communities, how has this telehealth impacted this part of the community? We do know that about 23% of self-identified respondents using a survey used telehealth during the COVID-19 pandemic. And we have seen studies that show that it has been very beneficial and helpful with getting access to telehealth, particularly with the software and the platform being a little bit easier to use on the phone. While some people may not have internet to use on a computer, they may be able to use their cellular data or something of that nature to still have the visit. So that has been just, a very helpful with regards to improving and streamlining that support and access to care to our patients with Parkinson's disease. Also, we noted that telehealth visits, of course, are preferred to no care at all. They can be that bridge or that bridge that gap between not being able to see, as Dr. Falconer said, your clinician in a year, or being able to get them in a little bit quicker because it's a telehealth visit. So having that connection and bridging that gap between the long wait times or not being able to see a provider in person due to COVID or other issues has been tremendous. Also, telehealth visits for video were comparable in quality of care to in-person visits among people with Parkinson's disease, as Dr. Falconer already mentioned. And that is pretty new. I think, as stated before, there have been some providers who just want to really, like Dr. Falconer said, just really touch you, really have that personable a visit with you where you're in person together. But, I push back on that and I challenge that a little bit, that I feel that our telehealth visits are even more personable. I get to see some of your family members, some of the patient's loved ones, some of the people who are in their home with them. So I can really connect. They can see me. I'm not wearing a mask. I'm not, standing back, and so you really want to consider giving it a try if you haven't already done it, because what it can do is it can really bridge that gap. And it is a lot more personable than I think we thought in the past, if that makes sense. Finally, telehealth provides an alternative form of communication and connection with people in the community. Living in Georgia, we have different parts of that area that can be a bit more rural. And the travel time, as Dr. Falconer has already stated, and the wait time can be a bit cumbersome. So having that different form of communication where you can do a video visit and really have a conversation with them and examine them on different levels can be very beneficial to the community. And with that, I will hand that over to Dr. Gilbert.
Thank you very much, Drs. Branson and Falconer. That was excellent information. And I know everyone listening has learned already a lot and are now ready to ask their questions. So it's time for our question and answer session. Now, before the operator gives instructions to queue for questions, I'd like to remind all of you that there are many, many people on the phone and the web. So for everyone's benefit, please keep your questions general in nature, and then we will provide an answer that's general in nature. For our telephone participants, your telephone line will be muted after you ask your question. So operator, can you please give instructions to our telephone and web participants so they can queue themselves to ask a question?
Thank you. For telephone participants who would like to ask a question, please press star 1 on your telephone keypad. A confirmation tone will indicate that your line is in the question queue. You may press star 2 if you would like to remove your question from the queue. For participants using speaker equipment, it may be necessary to pick up your handset before pressing the star keys. For web participants, please input your questions type your question in the Ask a Question box under the speaker video window to submit your question. One moment, please, while we poll for questions.
Okay, so we have a bunch of questions that came in as our presenters were presenting, and please feel free to ask your questions now as well. So our first question, either of you can answer this. Is there a directory available by state listing movement disorder specialists who provide telemedicine services and their fees? Anyone want to take that one?
Ooh, Dr. Branson, do you know of one? Because I don't think there is.
No, but that's a great idea for MDS to do that. We do have a list of providers who are MDS members on that website, but they do not state if they provide telehealth or not.
So great question.
To that point of fees, in the eyes of all CMS providers, Medicare on down, a telehealth visit is on par with an in-person visit. So it's not a separate fee schedule. So whatever your in-clinic copay is for an in-person visit, it works the exact same way cost-wise for a telehealth visit.
The exception with that is people who are uninsured. So if they are uninsured, there may be a fee or cost and that will be just dependent on each individual provider.
Okay, great. Thank you. So information to take back to our Movement Disorder Society to perhaps come up with such a list. So thank you for that. We have another question, and this is sort of stating a little bit of uncertainty with the whole topic of telemedicine, and is stating, will this be the new normal, having telemedicine, even when it comes to the administration of medications? And I'm going to editorialize a little. I think what the question is asking is, if medication change is necessary or something's going wrong, is a telemedicine visit really, really good enough?
Dr. Branson?
Yes, I do. I think that it is our new normal, and it is really, really good enough. I think we've been doing this 2 years, some longer, depending on when it really started for them, that we have become comfortable. There are DBS companies that are allowing us to change their settings with remotely. So yes.
Yeah, well, in back to one of the earlier points, it is so much easier. You think about without telehealth. If you think you have a medication problem, you're going to either call my nurse and go through a loop of trying to find an answer, or you're going to message me through our portal, and I might reply back with, I'll reply back with guidance. But if we needed to see each other, it would be okay, I can maybe fit you in at this point a week or two out, and with my PA here, there, the other. But with telehealth, it literally can be as easy as, let's just meet up virtually tomorrow morning, because it's just so much easier logistically.
Okay, great. Thank you so much. We have a question directed to Dr. Falconer. We are in Maryland. What can we do to permit a telemedicine visit with you in Virginia? Who makes the decision here in Maryland?
Yeah. Well, so it sounds like some cheeky thing that people have said for 100 years, but you really do need to call your congressman or your senator and let them know that this is a problem. This has affected millions of people across the U.S., where during the pandemic, we established a relationship, a treatment pattern, and help for folks at home. And then all of a sudden, very arbitrarily in February, I'll never forget it, all of a sudden we got a message saying you can only do telehealth in state. And we were having people with appointments scheduled where we had to tell them, we're so sorry, legally we can't see you anymore. And so it's a state licensure thing, and it can be remediated or at least helped on the federal level. And there's a lot of advocacy going into it. But if you think it's as ridiculous as I do, call your local senator or congressman. That's really the recourse.
Fantastic. This is a related question. You brought up the concept of advocacy, of actually exercising our voice as in a democracy. And people on the call may know that there is a national End Parkinson's Disease bill that's going through Congress right now. And the question is the issue of telehealth part of this bill?
Oh, I don't know. Dr. Branson, do you know?
I can maybe speak to this if you are okay with that. And just to clarify, the bill, who's ever asking the question, is a very, very generic bill. It's basically saying we are going to form a plan to end Parkinson's disease. And so the answer is yes. Sort of any issue that touches Parkinson's disease will hopefully become part of that bill. So back to Dr. Falconer's point, definitely raise your voice, get that telehealth information so that the congressmen know that that's a big issue for you.
And if your voice is quiet, don't forget speech therapy. It works fantastic to make that voice even louder.
Very good. So we now have some additional questions that came in earlier before the webinar. So someone asked, we have a 3-hour drive to see our neurologist in person, and that can be very stressful. Is that 3-hour drive worth it? Should we keep doing telehealth? What are the benefits of in-person visits? Should we do some visits in person, some visits telehealth? How should we proceed from here?
Yeah, I can take that. Yes, I think a combination is really good. You don't want to not go in. It just depends. It will be an independent decision because it's just based on the care and some of the problems you may or may not have. So therefore, I think the best part of telehealth is that you can do both. You can come in and do that 3 hours, or you can do the telehealth. And there's no either or. You can do both if you need it.
And ask your doctor. I get questions all the time through my chart. Hey, do you think we can do our next visit through telehealth? And I'll honestly tell you, no, you really need to come in, or yeah, absolutely. Just don't drive while you're doing it. Dr. Branson mentioned it. I can't tell you how many people who we will log into the virtual visit and I'm on their lap looking up at their nose as the world is whipping by. And I'm like, this is not safe. We need to reschedule or pull over because no. Yeah, it's crazy. Don't be driving.
Don't drive, and don't see a doctor and drive. That's the lesson. We have a great question here. I live by myself, and I don't have anyone to film me during my telehealth visit. Will telehealth still work for me?
Yeah, I can take this one. That's yes. We see a lot of folks who live alone and don't have, let's say, a camera person there to help. As long as you can get logged in on a computer or your phone, we can still see a move, right? We can still angle the camera and watch you walk up and down the hallway. I think being solo wouldn't be a reason not to do telehealth. Though it does bring up a good point that I know Dr. Branson always speaks on, and we all do, is that no matter who it is that's in your world with you, whoever that partner is that goes through that journey of the day with you, always invite them to come. In person, on telehealth, we get so much good information from that person who's on this journey with you. And it's most likely a spouse or a child, but for a lot of people, it's their friend who sits next to them at church. It's their person they go to dinner with. I had a guy yesterday that he brought his Elks buddy that he sits at the bar with 3 days a week. Bringing that person into the clinical environment is incredibly helpful. And it's helpful, especially with telehealth, because they can help too.
Excellent. We have a great question that just came in about speech therapy. So can ancillary services also be done via telehealth? And what about platforms such as Luminosity, where you're engaging a virtual sort of therapy? What do you think about those two issues?
What do you think, Dr. Branson?
Yes, and yes, yes, definitely. They were, at least where I'm at, they were doing that during COVID, speech therapy virtually. There were groups. I'm not familiar with Luminosity, so I might have Dr. Falconer speak on that one, but absolutely.
Well, the example of Luminosity is a good one. That there are a lot of things we can do on virtually to help issues. Luminosity is a little bit of an odd one, though. There's data that maybe it doesn't help to the cost of which a subscription requires. But again, all tools and all things are good if used in the right context. But a lot of these things are all still virtual. Look, our center alone, we offer 50 some odd programs a month of some kind, including exercise and speech therapy. And we get 200 to 400 people at every one because people love the ease of doing technology. So just look for it. It's all out there.
Great. Thank you.
And just going back to that, it's talking about one or the other. It can be a hybrid. Some places are doing in-person and telehealth. So making this our new normal provides you with some convenience of, if you can't make it, if something has happened suddenly, you can still attend. You won't miss out on that, therapy.
Great. We have a great question that just came in. I live in Ecuador. So we're talking about international Parkinson's patients. Can I get a telehealth appointment with a Parkinson's disease specialist in the United States? And what would be the cost?
Well, Dr. Branson, go for it. I need to distill what I've been told. Here and I'm sure Atlanta too, here in DC, we're a huge international destination, but I have to figure out the easiest way to explain how that's happened over the last 3 years.
Yeah, I know. And it's changed, right?
Yeah.
So, the rules were really relaxed, as Dr. Falconer has already stated before. And we're like, sure, yeah, absolutely. Now I think it just depends on if some people live in Ecuador and the United States, and they have residence in both locations. And so that would be if you have some sort of residence in the United States in a certain place, then absolutely. There may be a cost if it is international, but I don't think that people have released those fees because they're just going to vary state by state, provider by provider. Like if it's in a hospital versus an outpatient clinic, that will vary.
That was a great answer, because the honest answer is we don't know. Ask. If you're in Ecuador, call up who you want to see and ask, and they'll be honest. We've had people where we've done international and it worked out, but usually at our center, they send in a request and it goes through like a special, I don't even know what it is, and they tell us if we can do it or not, or if it's cash or insurance. But I think the counter is we can do it. Like, it's doable. The technology works great. Dr. Branson mentioned one of the DBS providers has the ability to do tele-DBS, so we can adjust the DBS platform remotely. I had a patient who went to Spain on a vacation, landed because of the time change, and the stress was just a mess. We connected to her DBS device on the cell network in Madrid, adjusted her DBS, her tremor stopped, and she had a great trip. So it's all doable. But I think that's an important point of all of this, is that the cat is out of the bag. We've built the infrastructure. We've made the awareness. Telehealth and our ability to connect remotely is there. We have to keep using it. We have to keep talking about it. And we have to keep promoting new and novel ways to increase access. Otherwise, there is a chance it just goes away if people don't find utility in it. So that's an important part of that awareness part, too.
Great. Thank you. We have another new question that came in. Is Rocksteady Boxing available through telehealth? And I benefited greatly from that program. Not available now where I live. Can I access it remotely?
Yes, I think we both are nodding our heads. Yes.
You just have to find the group. There are a bunch of groups that are still doing it remotely. I know there's a big group in the Boston area that's still doing remote Rocksteady. Because it's important. That left hook is a good one. Yeah.
Very good. Here's a great question. How safe, technologically safe, is a virtual visit using technology? How can I know for sure that unauthorized people won't have access to the visit?
So that's going to be on the provider side of things. You may not see that, but all of our platforms are supposed to be HIPAA compliant. So we are ensuring that this is a safe visit, that you won't get your information won't be released. Now, I have seen people have issues on their end and things of that nature, but the software or the platform that all providers are supposed to be using are supposed to be HIPAA compliant.
Okay, great. So not too many concerns about that, although understandable why people would have concerns in this day and age. I want to go back to the previous question who had asked about Rocksteady Boxing. If the person who submitted that question calls the APDA hotline, which is 1-800-223-2732, they will reach someone who will be able to connect them to a Rocksteady Boxing virtual class. So hopefully you will do that. That's 1-800-223-2732. Okay, next question. Will my televisit be recorded properly in my record like a regular visit?
Sure, I can give a quick answer to that. Yes. I mean, the video itself is not recorded, so we don't keep recordings of our visits, just like we don't record you when you come to clinic. We, as the physician, when we're doing telehealth, like you're here on my screen, but the rest of the screen is still the medical record, and we're entering all the usual info and data that we do in an in-person visit. So it's very much it's the same documentation that we use for both.
Okay, great. Next question. My doctor suggested that we do a visit over the phone, so presumably just audio. Any thoughts on doing it that way?
So I have done that, but I don't do it as a visit. It's not considered a visit if it's over the phone and you can't see the person. that's a telephone call. And so I may call them if they have any questions. But if it's a visit, there has to be video, and you have to see the person so that you can speak with them and do some sort of an examination if needed.
Okay, great. But better than nothing, I suppose, is speaking. So someone asked, can you repeat the number to call, in this case for not Rock Steady Boxing, but really any reason to call our helpline, which is 1-800-223-2732. So just wanted to repeat that number for the questioner. We have another great question. I have had both telehealth and in-person visits, and I find that my doctor is much more willing to make changes in my regimen when I'm in person, as opposed to keeping things the same when I do telehealth. Do other people find that to be the case?
Well, that's very provider-based, I think, and experientially based. I would challenge everybody on the call because you can't control your doc, right? As I tell my 8-year-old, the only person you can control is yourself, right? Especially his 5-year-old sister, can't control her. But it's just a reminder to folks that what you bring to the table is extremely important. And so you can't really tell your doc to do things different. So think about how you approach the virtual visits. I find that patients tend to be a little more everything's fine through telehealth. And so it's just a reminder to everybody that how you start the conversation, how you go into that visit is extremely important. And to lead with the things that are bothering you, to lead with the things you want to talk about. And if you feel like you aren't doing your best, have the courage to ask for a change, because it's all about you. And it takes being a confident advocate for yourself to really sometimes move the conversation forward.
Okay, great question.
Absolutely. Yeah.
So not so much about telehealth versus in person, but how you advocate for yourself.
If you feel like things need to change, if you feel like you're not able to go to dinner with your friends and you want to, talk about it. Don't just say I'm doing fine, because in the U.S. the average neurologic visit is 7 minutes. Don't know if you know that, but it is. And so what you say up front counts. If the doc says, "How are you doing?" and you say, "I'm fine," then that doc, as well-meaning as they are, is going to go through their mental checklist and say, "Oh, good, this is a quick one," and then come back in 6 months, right? If you lead with, "I'm doing fine, but I really want to do Zumba at 4 o'clock, but I feel like I can't," then you're going to talk about Zumba at 4 o'clock and how we can get you back doing that. So, have the courage. You can do it.
Yeah, just to add to that, and that's what we were talking about with the visit, preparing for your visit. That is a part of that. Preparing, things happen, people forget things, writing down what you want to talk about and having that agenda set so that you can have those conversations. Now, you may not get through everything, but just the top 3, the top 2 things that you want to talk about, and making sure that you're being heard on that.
Great. We have another question. Would you recommend that the first visit, as opposed to follow-up visits, be in person versus telehealth?
Dr. Faulkner, I mean, personally, I think it's going to depend. It's just going to depend. Like, I also do sleep. So some of my first visits in sleep are fine with doing telehealth. It depends on the complexity of the nature of the problem, the symptoms, some of the movement problems. It's going to vary.
Yeah, I'd say don't rule it out. I still see a ton of folks through telehealth for first visit. They get just as better as the people who come in person. I mean, the beauty of what we do is that there are so many options and therapeutics that we can employ to try to help the things that are bugging you. Really, for a first visit, the history is what's important, which we can do over telehealth or in person. And then seeing how you're moving is the second important thing. And then we pair that with your treatment regimen. And for most people, how you're being treated, the medicines you're taking, tend to reflect the limitations in your day. And so coming up with a better, more targeted plan is something I find we can do in person or through telehealth. And so I find it to be okay.
Fantastic. Well, with that, we have come to the end of our question and answer session. I wanted to once again thank Drs. Faulkner and Branson for joining us, for your fantastic presentations, for your very thorough answers to the questions. And I apologize if there are any questions that we left unanswered. And if you have a question and would like to speak with someone from APDA and our Scientific and Medical Affairs Department, I encourage you to visit our website at apdaparkinson.org, or again, call our toll-free helpline 1-800-223-2732, and you can access even more information then. And if you enjoyed today's webinar, we hope you will consider supporting APDA with a donation, because with your help, APDA can deliver more programs and services like this one. I want you to remember to check out the APDA Symptom Tracker app, which is an app that helps you or your loved one track their Parkinson's symptoms. The Symptom Tracker is available in English and Spanish and can be downloaded from the Apple Store or Google Play. And I want to emphasize to everyone on the phone that we really do appreciate your feedback and comments, and we want to make sure that you complete the program evaluation form. To join us in this fight against Parkinson's, to learn more about the support APDA provides across the country through our network of chapters and information on referral centers, as well as our National Research Grant Program and our Centers for Advanced Research, please visit us at apdaparkinson.org. We all agree that being informed about your disease and treatment options is the best way to empower yourself and take control of your care. Have a wonderful rest of the day.
This concludes today's telephone web education program. You may disconnect your lines at this time. Thank you for your participation.